So a lot of times if we're restricted in the left low back, we're going to have some type of compensating restriction on the right side, as that is a developmental cross pattern. So I'm just going to press around and press and hold. Perfect. Then what we'll do, there's just a little more movement there. All done. Hi guys, Dr. Ludeman from Bolingbrook Family Chiropractic in Bolingbrook, Illinois. I'm a pediatric and prenatal chiropractor, and today I'm going to adjust a 2-week-old baby A in labor. She was stuck on her mom's left side, so mom is now noticing that she has just a little kink on the left side. She's doing really good with her sleep. She's doing well with her latch. We just got her to take a new pacifier, so let me show you how we adjust a baby. So I wash my hands before this, everyone, so you can come this way. So what I'm going to do is we're just going to check her little hips. So we're going to bring those up. We're going to rotate on this side, rotate on that side. Her hips aren't clunking, so that's good. That means we have no signs of hip dysplasia. And so mom says that she's pooping daily. Sometimes she's a little grunty when she poops, so we're going to check her sacrum. We're going to check her low back. And so when we're adjusting babies, we are using our finger pad, and it's about the pressure that you would put when you're testing the ripeness of an avocado. So you can see that I'm pressing right here on, coincidentally, the left side of her low back. And I'm just going to press and hold. So what you'll see when we're adjusting is that babies will move around that point that you're pressing on. So she was a fast labor. Like I said, she was stuck on the left side of mom's pelvis. And so babies, they should eat, sleep, and poop. There's no reason for them to have muscle spasm at this point. They're not really moving. We're doing tummy time. We're not in a rolling pattern yet because we're 2 weeks old. So if we have any trigger points or muscle spasm around the spine, that's indicative that there's a change in nerve function there. And so for her, those nerves in the low back correlate to her guts and digestive system. So a lot of times what will happen is that we'll adjust a baby in office and we'll see them have a blowout within 24 to 48 hours later. We have coined that the poop adjustment. I'm sure that you've seen that all over the internet too. But the research behind it is really that we are just stimulating those nerve roots to work into their full function. And when those nerves don't have interference, and the body is allowed to do what it needs to do. And you can see that she is just sleeping away through her adjustment. Like I said, we're using enough pressure to check the ripeness of an avocado. We actually train when we're learning pediatrics, and we will use a food scale and press our fingertips to the food scale to make sure that we're getting the right amount of pressure there. So now this is probably going to be the most traumatic part, because I'm going to go ahead and I'm going to roll her over onto her belly, and then I'm going to support her head here, but also same thing with our pillow. She's going to have some support. Good job. And then we're just going to little bit of movement there. I know, sweetheart. There we go. And that's the most movement that you're going to hear from us there. And then I'm going to check the ligaments around her sacrum, and so I'm just going to press and hold on this one here on that right side. So a lot of times if we're restricted in the left low back, we're going to have some type of compensating restriction on the right side, as that is a developmental cross pattern. So I'm just going to take my thumb and I'm just going to press here up along the side of her sacrum, and I'm going to press and hold. And you might see her, because again, we're 2 weeks old and reactive, so you might see a little wiggling around as we get that neurological pattern to activate. But now we're in a nice, comfy, cozy position. She has some nice right head rotation, and she has a really good latch. So I'm just going to press around and press and hold. Perfect. And then we're going to go ahead and we're going to flip her back around. And yes, we have her in a recalled boppy, but she is being supervised the entire appointment. We're not letting her airway get restricted. So when I'm palpating her head, her right side, the right occiput is sitting lower than the left. So what I'm going to do is I'm going to do a little hook and hold here, and I'm just going to press up and hold. So again, all of these contact points is a press and hold. You're not going to see any snapping of her neck or hear any popping or clicking. This is also a part of what is considered cranial sacral therapy. So in cranial sacral therapy, you are assessing the sacrum, and then you're assessing the cranial bones and the occiput. So I will start with the occiput first, and I'm just going to have that press and hold. And then if you are looking at her from head on, there's a little left rotation of this left frontal bone is slightly more anterior than the right. So then what we're going to do is I'm going to hold on this right occiput, and then I'm going to do a little gentle pressure on this left frontal bone, and I'm going to be pressing down and pulling down this way. And again, our pressure is so gentle that we're just going to sleep right through this adjustment. And this is your little reminder that if you are seeing someone for cranial sacral therapy, they should in fact be touching their head and their cranial bones. If you're seeing someone that is not certified in cranial sacral or has maybe taken an online course, if they're not assessing their head, then they're not actually doing the cranial point of cranial sacral therapy. So then I'm going to go ahead and I'm going to check the rest of her sutures. And if I check on this temporal bone, she does not like that. So I'm just going to do a little press and hold with my right hand here, and I'm stabilizing on the left side. What you can't see is I'm also stabilizing the occiput underneath her head with my fingers as well. So we're just going to take a nice big breath. Baby A is still hanging out in a nice dream sleep. She's probably dreaming of mom's milk. But as you can see, we're able to work along those sutures. And now what I'm going to do is I'm going to go ahead and glove up, and we're going to check the top of her palate. So again, if you're seeing someone and they're doing cranial sacral therapy, there should be an intraoral assessment or application to that. Again, if they're not doing that, then they're not actually doing cranial sacral. So I'm just going to pass you right there. Here we go. So baby A has a nice chomp. If I go ahead and sweep to this side, she has a good chomp on the right side. Her tongue follows really well. Good job. And then we're going to get all the way to the back here. I'm going to check the sphenoid bone on the left side and the sphenoid bone on the right side. And to clarify, nothing that I'm doing is painful. She's just mad that my latex-free glove is not producing milk. It's a little bit of a tease to put a blue finger in someone's mouth and no milk come out. So then I'm going to sweep on the other side. I'm going to check her left palatine bone. And then I'm going to go ahead and sweep on the right side and check that right palatine bone. Her inner maxillary suture is fine. There's no overlapping there. And you can see baby A is trying to get a solid latch again on my finger. But again, disappointment because there's no milk coming out. And then what you'll see me do is I'll go ahead and I'll contact her occiput, and then we're just going to take her through a gentle, somewhat active, somewhat passive range of motion. And she should be able to latch onto my finger and then go through full range of motion here. So you can see I can get her to almost, now we got a full 85 degrees of rotation on the right, and she's able to maintain her latch and her suckle. And then I can bring her back to neutral. She's gonna, I know, sweetheart, I'm sorry, there's no milk. And then I can do the same thing and take her to the left. So her left side where she is a little tight and has that lateral bend, I'm actually, once I get her to engage intraorally, I'm able to cue her through what would be a more passive range of motion. And then I can go back and I can check her occiput, I can check her atlas, I can see that everything is even. I know, good job. And then what we do after that is we go back and we check her thoracics one more time, and then she's all done. I know, I took your Cassie. I'm so sorry. Yeah, see, and then she does a really good job herself of getting into her right rotation. So then what we'll do, there's just a little more movement there. All done. Good job, baby A. Okay. And that's what a pediatric adjustment looks like.